Hi, my name's Heather and I'm a junior nursing major at UNH. I'm going to show you around the Health Sciences Simulation Center. This is our fundamental skills lab where students learn core skills before moving on to clinical and other simulations. One skill we learn in the skills lab is how to connect IV fluids to a patient. Here's one of our 4 medical surgical rooms. It simulates a real hospital room, and here we apply our skills from the skills lab and bring it into a real patient situation. For example, right now my patient's nauseous, so I can come over here and scan her wristband, and then I can scan a med, and it will go into her chart that I gave her the med. This is a one-way mirror where our sim faculty watch us during our simulation and see how we care for our patient and provide us feedback in debrief. This is one of our 2 pediatric rooms. This is a school-age child and our other one is a 9-month-old infant. Here we can practice our clinical skills on all ages and sizes. As you can see, our supplies are smaller to fit the child's face. This is our critical care room, which simulates an intensive care unit. Here, we can take care of more critically ill patients and practice things like medical emergencies and codes. Welcome to our family room. Here, we can practice our maternity skills like births, neonatal assessments, and postpartum assessments. This is one of our debrief spaces where we pre-brief the case, get to watch our classmates and their skills, and then debrief how we felt and what we can improve on the next time. This is our clinical skills lab, which uses AI and VR. So Meredith right now is caring for a virtual patient, and it helps us to do simulations that we can't put on in the simulation lab. This is one of our 3 exam rooms. Here, we can practice with patient actors in the outpatient setting. Thanks for following along on the tour of the Health Sciences Simulation Center. I hope to see you soon.